Today, I will be talking about the basics of the most common sexually transmitted infections. If you would like more information about any of the following topics, visit cdc.org and type in your topic of interest. Did you know that half of sexually active people ages 18 to 25 will contract an STI by the age of 25? True or false? Asymptomatic means that a disease's symptoms only affect one party. The answer is false. Asymptomatic means that a disease's symptoms do not produce or show any symptoms. This does not mean that a person does not have the disease, but only that no symptoms are present. Infected people are still carriers of the disease and can still spread it to other people. The majority of STIs are asymptomatic. That is why using protection and getting regular STI testing is so important. True or false? 80% of people who have a sexually transmitted infection experience no noticeable symptoms. The answer is true. This, again, is why it is so important to get regularly tested and use the proper protection. These are the most common STIs broken down by whether they are curable or incurable. Curable are syphilis, gonorrhea, chlamydia, and trichomoniasis. Incurable, HIV, HPV, hepatitis B, and genital herpes. Some STIs are curable with medication and prescription drugs. Some viral STIs, such as HPV and hepatitis A and B, have vaccines. Bacterial STIs can be treated with antibiotics. Others, such as parasites and mites, can be treated with prescription medications such as creams. For all other STIs, medication can only help alleviate the burden of the symptoms, but the medication cannot cure the infected person. Syphilis is an STI with 4 stages. If not treated, it can cause long-term complications. It is spread during vaginal, anal, or oral sex, and you can spread it from direct contact with an open sore on the penis, vagina, anus, rectum, lips, or mouth. It can also be congenital syphilis, which is spread from a mother to an unborn baby. The symptoms are hard to determine because most mimic symptoms from other diseases. Syphilis's 4 stages are primary, secondary, latent, and late. It is treatable with antibiotics, but the damage that is already done by the infection cannot be undone. The primary stage symptoms has an appearance of sores, which indicates where the virus entered your body. These sores are usually painless and can go easily unnoticed. Sores last 3 to 6 weeks and will heal regardless of treatment. You still have the virus even if the sores go away. Secondary stage is marked by skin rashes and sores in the mouth, vagina, or anus. A rash could appear and is rough red or reddish-brown spots appearing on the palms of the hands, bottom of the feet, or other parts of the body. Other symptoms of secondary stage include fever, swollen lymph nodes, a sore throat, and headaches. These symptoms will also go away regardless of treatment, but that does not mean that the infection has left your body. Latent and late stage occur 10 to 30 years after infection began. Symptoms include abnormal muscle coordination, paralysis, numbness, blindness, dementia. Damage is done to the internal organs and complications can lead to death. It is important to catch syphilis in its early stage. Gonorrhea is an STI that can affect males and females in the genitals, rectum, or throat. It is very common, especially among people between the ages of 15 and 24. The CDC estimates that 820,000 people in the United States contract this infection. It is spread by having vaginal, anal, or oral sex with someone who has gonorrhea or through childbirth. For females, the symptoms are painful or burning sensation during urination, increased vaginal discharge, and bleeding between periods. For males, they would experience burning while urinating, white, yellow, or green discharge from the penis, and painful or swollen testicles. However, it's often asymptomatic at first. Untreated gonorrhea and chlamydia can lead to infertility, causing pelvic inflammatory disease. Chlamydia is a common STI. It is the most reported and affects both males and females. It is spread through vaginal, anal, or oral sex with someone who has chlamydia. The symptoms for females are abnormal vaginal discharge, burning sensation while urinating, and it can scar female organs. Males might experience discharge from the penis, burning while urinating, pain and swelling in one or both testicles. It is treatable with antibiotics. However, 75% of females and 50% of males are asymptomatic. This just proves even more why you should get tested often. In women, untreated chlamydia can spread to the fallopian tubes and uterus and cause pelvic inflammatory disease, as mentioned before. This can lead to long-term complications in a woman's reproductive system and potentially lead to infertility or ectopic pregnancy. Trichomoniasis is a common STI caused by an infection from the parasite Trichomonas vaginalis, known as the most common curable STI. The parasite is spread during sex with an infected person. Infected people can pass this parasite even if they are not showing symptoms. The symptoms vary, but most men and women who have this parasite can't tell that they're infected. If noticeable, the symptoms range from irritation to severe inflammation. Men and women could also have a burning while urinating. The symptoms may show up 5 to 28 days after contact, but 70% of those infected are asymptomatic. It is treatable with prescription drugs, and mothers with trichomoniasis are prone to give birth early, preterm delivery, and babies born to mothers with the disease are prone to have low birth weights. HIV, human immunodeficiency virus, weakens the immune system by destroying cells that fight infection and disease. Mucosal, damaged tissue, or bloodstream exposure to certain body fluids from an infected person, such as blood, semen, pre-ejaculate, rectal fluid, breast milk, or vaginal fluid, can spread HIV. Most common exposure comes from sexual behaviors, childbirth, or needle and syringe sharing. The symptoms people may experience are flu-like symptoms 2 to 4 weeks after infection, but the only way to know whether you have HIV is to get tested. Once you contract HIV, you have it for life. 1 in 5 people living with HIV in the US don't know they're positive. There are medications to help you live longer. However, as I mentioned, it's not reversible. If students are on the Purdue Student Healthcare Plan, they can get PrEP, medication that can help prevent and reduce the level of HIV virus in the body for around $30 a month. HIV leads to AIDS when the body's T cell count drops under a certain limit. The reason for this drop is because the HIV virus directly targets T cells in the body. Fewer T cells means a weakened immune system. HPV, human papillomavirus. So common that almost all sexually active males and females will get it at some point. It is the most common STI in the nation. There are many different types of HPV. Some can cause genital warts and some can cause cancers. It's most commonly spread through vaginal or anal sex with someone who has the virus, but can also be spread from oral sex. As quoted from the CDC, most people with HPV do not know they're infected and never develop symptoms or health problems from it. Other people might develop genital warts or have an abnormal Pap test. HPV causes 70% of cervical cancers worldwide, and there is no cure. Many are asymptomatic, but some will develop genital warts. Vaccines are available. Hepatitis B. This is a liver infection caused by the hepatitis B virus. It is spread through intercourse with an infected partner, needle or syringe sharing, childbirth, contact with blood or open sores, a razor or toothbrush sharing with an infected person. The symptoms include fever, fatigue, abdominal pain, loss of appetite, dark-colored urine, nausea, vomiting, joint pain, jaundice, or clay-colored stool. This is transmitted through blood or bodily fluids, as mentioned, and can take 6 weeks to 6 months before symptoms begin to appear. However, you could also be asymptomatic. There is no cure, however, there are vaccines available for prevention. When someone has hepatitis B, it causes them to be susceptible to getting hepatitis D. Genital herpes. This is a virus caused by herpes simplex type 1 or 2. 1 in 6 people between the ages of 14 and 49 have genital herpes. This is spread by having vaginal, anal, or oral sex with an infected partner. Exposure to a sore can spread the virus, but it can also be spread by someone not showing symptoms. When shown, the symptoms most people have are generally mild. It could appear as blisters on or around the genitals, rectum, or mouth. When an outbreak occurs, flu-like symptoms could also appear. There is no cure, but there are medicines that will help with or prevent outbreaks. When someone has genital herpes, they have an increased risk of transmitting or becoming infected with HIV. Genital herpes can lead to premature pregnancy, cause a newborn to have neonatal herpes, or sometimes can cause a miscarriage. Scabies is an infestation on the skin of the human itch mite parasite Sarcoptes scabii. The mite burrows into the skin where it lives and lays eggs, according to the CDC. It is spread through direct contact with someone who has scabies or through contact with their clothing, towels, or bedding. The most common symptoms are very intense itching and/or a skin rash that looks like pimples. The mites can live for 3 days on clothing, towels, and bedding of an infected person. You could be asymptomatic for the first 2 to 6 weeks. Then it will cause intense itchiness, especially at night. It is treatable with a prescribed medication, and you can disinfect your clothing and bedding by washing it with hot water and drying in the dryer. You can also seal it in a plastic bag for 72 hours. Institutions such as nursing homes, extended care facilities, and prisons are often sites of scabies outbreaks. Pubic lice is a parasitic infestation also known as crabs. They typically attach to pubic hair but can also be found on coarse hair on the body, such as facial hair, chest hair, or armpits. It is most commonly spread through sexual contact but can also be spread by contact with infected clothes, towels, and bedding. The symptoms are itching at the site of infestation, or intense itching can lead to scratches or open sores that can cause infection. These insects are tiny and crab-like and nest in the hair. They can live for up to 1 to 2 days in bedding, towels, or clothing. It can be treated with both over-the-counter and prescription medications. And lice eggs, or nits, can be seen attached to the hair. Pubic lice on the head of a child may be an indication of sexual exposure or abuse. This chart is a chart of different treatments for each STI. The first column are STIs treated by antibiotics: chlamydia, gonorrhea, syphilis, and trichomoniasis. Antibiotics will need to be prescribed by a doctor, and the prescription amount should be taken in its entirety. The second column, prescribed medications: scabies, pubic lice, parasites. Prescribed medications other than antibiotics, such as creams, can be used to treat STIs that I just mentioned. A prescribed medication provides relief, but it doesn't treat anything, it just helps with the symptoms. Vaccines. HPV. This vaccine prevents associated future complications but cannot prevent the HPV virus. Hepatitis. This vaccine is not for hepatitis C. Hepatitis C does not have a vaccine. And prescribed symptom relief medication, which means there's no cure. Herpes, HPV, hepatitis, and HIV. This is a chart of different ways that you can test for certain STIs. There is blood testing for HIV, genital herpes with no symptoms, and syphilis. There is urine testing for chlamydia and gonorrhea, and swab testing for chlamydia with a genital swab, gonorrhea with a genital swab, HIV with a mouth swab, genital herpes with symptoms, syphilis, a swab of the sore, and trichomoniasis. You should get tested every time you change your partner or every 6 months. While some STIs, such as chlamydia and gonorrhea, can be tested for at the same time, different tests may be needed to test for different diseases. So even though a swab test can be used to test for many different STIs, you may still need to get several different swab tests. This is because the tests use different antibody and antigen detection methods for each specific virus. The same principle applies to blood tests as well. There are ways to reduce your risk of contracting an STI. You always want to make sure to communicate with your partner before having sexual intercourse of any form, use protection no matter what, and avoid alcohol and drug use before sex.